Welcome to the 128th season of the Canadian Club Toronto, Canada's Podium. For over a century, this platform has been a gathering place for visionaries, public figures, and decision makers to discuss the most pressing issues of our time.
We've been having important discussions and debates around this podium in this country for well over a century. I call this a historic podium of record.
Our club's always been a forum for visionaries, public figures, and decision makers to command attention to the issues of our time.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
Bonjour tout le monde. Welcome to our nearly 1,000 online attendees from across the country. We are so glad that you have joined us here today for this really important discussion. Je suis très content de vous voir. Bienvenue. My name is Tanya Van Biesen, Canadian Club Toronto president and your host. Remember the days of encyclopedias and the evening news. We used to get our information from a limited number of sources like books, newspapers, television, and in-person meetings with experts. Now, with the internet and smartphones, we have a whole world of information at our fingertips 24/7. We can search for anything, anytime, and get instant answers. This has totally changed the way we learn, connect, and form opinions. And when you think about it, it is truly amazing, but it also means we need to be extra careful about what we believe and where we get our information from. We're about to get the latest insights on the increase of medical misinformation and its impact on physicians, the medical community, journalism, and all of us, the patients and clients. We're very grateful that the Canadian Medical Association and Abacus Data have teamed up to share these important insights with us today. Now, our ability to offer you these critical discussions is due to the generosity of our sponsors, and today's event is being sponsored by MD Financial Management and Scotiabank. I'd like to thank them. Thank you very much for your support. We are grateful that Canadian Bankers Association is our season sponsor again this year, and that Air Canada is also again this year our official airline sponsor. We are also proud to share that Canada's Forest Trust Corporation is our smart forest planting partner for a third season in a row, helping us to offset our carbon footprint. And today we are very proud to welcome students from U of T, TMU, Seneca and Centennial Journalism Schools, as well as representatives from TMU's The Dais. Welcome all of you, and we are expecting great questions from you. Now, before the speaker introductions, let me share some quick club business with you. I invite you to visit our website at canadianclub.org. Besides event and membership information, we also have a great on-demand feature if you've missed some of our past events. I also encourage you to share today's session on your preferred social media platforms. And then shifting to the event of the moment, one of my favorite parts of our events is the question and answer portion. On your tables, you will find pens and the real analog version of questions. So as you think about questions for our panelists, please jot them down. We will come around to the room and bring them to our moderator. Et pour nos invités en ligne, please hit the Submit Question button on the right side of your screen at the appropriate time should you have a question. Now it's time to introduce our speakers. I'll start with David Coletto, founder, chair, and CEO Abacus Data, who's going to share the insights from the survey. Dr. Joss Reimer, President, Canadian Medical Association. Dr. Teresa Tam, Canada's Chief Public Health Officer. Craig Silverman, national reporter, ProPublica and misinformation expert. Angela Pacenza, executive editor, The Globe and Mail. And our moderator for today, Elamine Abdul Mahmoud, radio host of CBC's Commotion. David, panel members, Elamine, Canada's podium is yours.
Well, good afternoon, everybody. Thank you very much for that very warm welcome. And it is great to be here. And it's a real privilege to be part of this project because I think it is so important. As a pollster, I have this, amazing job in that I get to ask thousands of Canadians hundreds of questions every week on things related to their relationships, what they're buying and selling. I spend a lot of time, maybe too much, talking about and asking about politics. But to me, one of the most fascinating areas is how we get our information, right? How do we come to understand our world, our place in it, and how we interact and relate to everything that's going on? And, when we ask the question of today's session, how healthy is Canada's health information ecosystem? I think we all need to reflect first on just how important that question actually is. As somebody, again, who lives in the world of perception, right? There's a number of physicians on our panel who live in the world of reality. But in my world, I live in the world of perception because if people believe something to be true, if they believe it's 40 degrees out when they wake up, but it's actually minus 40, imagine how they're going to feel if they dressed for a warm day, but it's freezing cold out. Right? What effect does that have on our thinking? And so I've seen firsthand how this information and news ecosystem shapes public opinion, right? And so if we're going to understand why do people think what they do, which ultimately leads them to behave in a certain way, I think we have to fully diagnose and understand how they get their information, how different we all are these days and how we get our information. And that's really what this study was all about. So I am grateful. I am so happy that the Canadian Medical Association has joined with us to do this. This is not a one-time thing. We're planning to do this annually. And I will say, when we started this project last year, this is our second survey. For the news folks who wanted to make some news, we were worried we weren't going to see much change. And I think one of the major takeaways of this research today is that things are changing. And that from 1 year to the next, in a 12-month period, we saw substantial numbers of statistically significant differences over time. And I'm going to get into that with you right now. So first, so how did you do this? And I'm not going to get into a polling 101 with you. You can come to my class tomorrow at Carleton University if you're interested. But this survey was done with over 3,700 Canadian adults. So this is a large sample, which allows us to dig deep and to look at demographic, regional, and other variables that might be driving or affecting the responses that people have. This survey was done after the U.S. presidential election. And that was we did this purposefully to just let that settle for a moment and let Canadians react to it, but recognize that that's when this was done. And so this is fairly recent data that was completed. Just to give context as well, there was some conversation and coverage of growing numbers of walking pneumonia cases in Eastern Ontario and Eastern Canada, as well as some discussions in Quebec about privatizing healthcare. So that's the context by which Canadians were answering these questions. So what I'm going to do today is walk you through some of the key findings. The full report is available up on the CMA website if you're interested in getting into the details. And I may not spend enough time on every single slide. There's a ton of data here, but I want you to get the key takeaways that I think is going to set up our conversation after quite nicely. Now, in terms of the key findings, I think, as I mentioned, over the past year, most important perhaps is that Canadians' encounters with health misinformation have increased significantly, okay? With more individuals than ever recognizing its prevalence, but also reporting its harmful effect on their lives and on the decisions that they're making. We know that the news ecosystem remains highly fragmented. I think every month, not every year or every decade, but every month, it is becoming more and more fragmented. And you're going to see in this data that somebody who's age 20 in this country today likely lives in an entirely different world as someone age 65. and then imagine all the variants of that in between. And to think about what that does, not just to how they feel about their own health, about how they access health professionals or health care, but the broader story around our democracy and our society more broadly. Those who rely heavily on social media, our survey finds, remain the most vulnerable to misinformation, and I'll explain that in a moment. And we see a direct link between those exposed to misinformation, those who believe misinformation, and negative health outcomes, which at the end of the day is what we're really focused on. Current efforts to combat misinformation are clearly falling short because the problem is getting worse, and it seems like it's accelerating, not ending. And so when we ask people, who do you think is most responsible to solve this, or at least control this, the answer might surprise you at the end. So let's get into it. I mean, the biggest trends are two things. One is more Canadians are turning to social media for news than ever before. I always like to repeat this stat everywhere I go, which comes out of this study, that 1 in 4 Canadians under the age of 30 say their primary news source is TikTok, okay? And it's no longer going to be banned in the United States, at least for now, and so that is part of the reality that we are living in. And we find that fewer Canadians than a year ago are going directly to news websites like Angela's to get their news and information, okay? So this is the dual dynamic, the two-sided coin that we're seeing. And so that increase in where we're getting our news and information is also driven by an increased desire just to tune it all out. One of the things we measure in this survey is news avoidance, and we've seen a 4-point increase in Canadians who say, I'm avoiding more and more news simply because it's all bad. It makes me sad. I don't want to know what's going on. Now, one of the big context setters, again, related to generation and media consumption, okay, is the difference across what Gen Z or Gen Z and millennials are doing versus those who are older than them, okay? When we ask people, what's your primary news source? More than half of millennials and Gen Z say it's social media, right? Among those boomers and Gen Xers, TV is still the primary source for most. Again, think about those two different worlds and what that means going forward. So the first thing that we wanted to really understand, and we, the team that was working on this, recognizes that so much of the content we get, generally speaking, right, but specifically around health news, is created and distributed from the United States, right? One of the trends that we have seen is that fewer and fewer news organizations are investing resources into reporting on health-related issues, right? And so as a result, that's getting replaced by what we see in the United States. In fact, 57% of Canadians say that most of the news they think is Canadian, but almost half say it is either coming from the United States or elsewhere, which suggests that external influence is still significant. We also wanted to understand, do Canadians think that AI is going to help solve this problem? And it's basically a split decision. A third think that it will have a positive impact on coverage. A third think it will be negative. But again, a big, wide generational divide, with 70% of Canadians under 30, those Gen Zers, thinking that AI is going to be a good thing, and pretty much everybody else either not sure or very skeptical about the effect that that's going to have. And so we're going to continue to monitor that as we go on. So we asked, again, the core question is, how often are you exposed to health misinformation, or how much do you believe you are? And that's important, right? And what we've seen is an 8-point increase in a year of those who say they at least occasionally believe they're exposed to this stuff. 4% say all the time, 14% say often, 45% occasionally. There is a rare endangered species of Canadians out there who say they never are exposed to it. Now, they're either oblivious, they either don't exist online, or they, don't want to believe it, right? But this is basically a widespread phenomenon. And what's really interesting is last year, we saw a fairly large gap between Anglophone and Francophone Canadians. That gap has all but disappeared. And so the likelihood of someone believing they're exposed to misinformation in the French language is the same as it is in English language in Canada today. When we look at it across generation, the story here is it's been an increase across the board. Older Canadians are less likely to believe that they're being exposed to misinformation, but even there we've seen a 4-point increase among boomers, so now that just half believe that they are. But look at the difference between those two younger generations and older ones, okay? 7 in 10 millennials believe they are exposed to misinformation about healthcare or health-related issues at least occasionally, okay? That's 7 in 10 of us. I'm a geriatric millennial in that category right now. Now, one of the things we did new this year, and I'm so happy that the CMA took the risk and not listened to me, but encouraged by my recommendation, is we did the very difficult thing of trying to measure just how susceptible are Canadians to misinformation. Now, this is not easy to do, and what we did isn't perfect. But what we did is we took some commonly believed mistruths and mixed them in with some truths and asked people, do you think these are true or false? And we gave them the option of saying, I don't know. And we took their answers, and you can see some examples here, like there was no widespread voter fraud in the 2020 US presidential election. In that case, 49% of Canadians believe that is true, which means half of Canadians either believe that was false or they are not sure, okay? And we took that and others related to health and other issues, and I'll show you another slide here that shows some others, like using chemical or mineral sunscreen can cause a vitamin D deficiency. In that case, 28% of Canadians believe that's true. A third were not sure. And we took those answers and we created an index that we think, as good as we can right now, measures susceptibility to misinformation. And the story is a concerning one, that we see almost half of Canadians, 4 in 10, just over 4 in 10 Canadians, who we believe right now are either very highly susceptible to misinformation or highly susceptible to. And what does that mean? It means that on many of those questions that we included in the index, that these are folks who said, I believe the incorrect thing, or I'm not sure. And you can go down that scale to the point where about 3 million Canadians, just to give context, 3 million Canadians are highly susceptible, we believe, to misinformation, generally speaking, whether it's about health, whether it's about politics, whether it's about whether the sun rises and sets, right? Or the world is flat. We didn't test those kinds of things, but you get the idea, right? And what was interesting first is that while there was a difference across generation, younger Canadians were slightly more likely to be susceptible at a higher level than older Canadians, it wasn't as big a gap as you saw in terms of how people get their information, which tells us that some of it is not just about where we are and where we live in terms of the ecosystem, but also about other things. Not getting into politics today, but politics is part of it. Where you live, who you're surrounded by, the access that you have to other types of information all contribute to whether or not you have higher or lower levels of susceptibility. And one of the things we wanted, the reason I encouraged this was not just to describe the level of susceptibility to misinformation in the country, but was to start to understand what's the effect. What does it mean that someone has higher susceptibility or not? And we'll get into that in a minute. We also have been asking Canadians, we give them examples of news stories they may see in the news. So for example, at the top of the screen, reports about burnout of health professionals like physicians and nurses, a real problem in many health professionals today. And we ask people, when you see a story like that, are you tending to fully trust what you read? Do you generally believe it? Do you take it with a grain of salt, or is it complete BS, right? And you can see that there is a gradient here. There are some stories like the one at the bottom, or near the bottom, the safety of a new vaccination, where there is a sizable number of Canadians, minority, but still sizable, who say, I take it with a grain of salt, or I don't believe it at all, right? And what we've seen across the board is the trust in these kinds of stories is down across the board by a statistically significant margin, signifying again that there is some eroding trust in the news and in the stories people are seeing about a range of things. Some of them aren't that controversial, or they shouldn't be, right? And yet there is a decline in trust right across the board. Now, one of the things we asked this year that was different is we said, what's your reaction when you see a quote or a message or any kinds of content that starts with many scientific studies have found, okay? And I know that we said many, not one, because one can sometimes cause an uproar of something. But when you see many scientific studies found, how do you react? Are you someone who's always trusts that research? Are you usually trusting, I'm skeptical, or I don't trust it at all? And if you look at the results here, there's, I think, two ways to look at it. One is the majority of the country says, at least trust most of it. My inclination is to say, I'm going to trust what the conclusions of that study were. That at the core of it, science is good. I like scientists. Scientists are noble. They are ethical, all those things. But on the other side of that coin is there's a sizable minority, almost 4 in 10 Canadians who say, I either not inclined to trust it or I'm skeptical, right, of what I believe. And this is like what we would describe as peer-reviewed, thorough, vigorous research that a large number of Canadians don't believe is true. And so then the question is, what's the effect of this? And specifically to health, we wanted to know, are Canadians recognizing that their exposure to misinformation is actually affecting their lives? And we can see across the board, first of all, increases in the proportion of Canadians who say, look, health-related misinformation has led to mental distress in my life, lower trust in health professionals, delay in seeking appropriate treatment or medical care, avoidance of effective treatment, even relationships with family and friends deteriorating. In all cases, we've seen the incidence rate of that, the reported incidence of that going up. So not only do we see people's perceived exposure to misinformation rising, not only do we know that the media ecosystem is increasingly fragmented, but we now have more evidence that the effect is real on real people affecting it. And I don't even need to get into it, and I hope the panel gets into the effect that this has on the healthcare system, by the way. That when you have people coming in and out of the system, questioning physicians and nurses and pharmacists and other health professionals, what it does to the capacity of our system. Now, one of the things we also explored is, what are people doing online, right? 4 in 10 Canadians tried medical advice they found online. Think about it, 4 in 10. Not all of it good, probably. Some of it maybe sound, but not all, we don't know. 1 in 3 have taken medical advice you got online instead of advice you received from a doctor. And have a few doctors on our panel. We can talk a little bit about that in a moment, right? You talked about Dr. Google on your introduction, well, right? Dr. Google sometimes might win out in a battle between what I see and believe and what you tell me is true. 1 in 4 Canadians have had a bad reaction, and they're admitting this, have had a bad reaction, adverse reaction, or negative impact on their health from following some advice they saw online, okay? And that's those who are willing to admit it, by the way. We don't know that number could even be higher. Now, one of the most interesting things that we learned in our survey I mentioned earlier is when you look at those who are very highly susceptible to misinformation and those who are not, and we look at, for example, those kinds of behaviors. I point your eye to the bottom of this screen, and the gap between those highly susceptible and those not on having had a negative effect because I followed something I read online or saw online or heard online. Right? 39% of those who are very highly susceptible to misinformation report that adverse health effect because of something they saw online. They followed something online, compared to only 2% of those who aren't. That's telling me there is a strong correlation, maybe causation, I'm not going to go there, between your susceptibility and access to this information and what it means to you going forward. Now, the good news is, as we dig into how do we solve this, right? What's the antidote to some of this? We wanted to understand, what signals do consumers of this information use to determine what's good and what's bad? And what we learned was consistent to last year and only slightly changed, is that who authored the information matters the most to more people, okay? 56% say who authored the information is most likely to signal accuracy to them, followed by where they got this information, and much less likely to think about quantity and quality, right? But one of the things I just learned secondary to this, and research that I did on Gen Alpha, right? This 12 to 16-year-old cohort that we really know nothing about, is that they're very different, right? That they see quantity as the indicator of accuracy. How many times is it shared? How many people are commenting on it as a signal, not necessarily expertise? So this is going to be a battle that we're going to have to fight. Now, some good news, and that is we still trust, most Canadians still trust many of the professionals and institutions that are on the front lines serving us and protecting our health and the health of the ecosystem. You can see at the top of that list, physicians, pharmacists, nurses, those frontline health professionals, still the most trusted sources of information that Canadians are reporting to. I do note, though, that 1 in 5 Canadians don't have a high level of trust, and that's still a lot. And that's something that protecting that reputation becomes important. Teresa, Dr. Tam is here, the Public Health Agency of Canada, despite all of the things that agency went through during the pandemic, still has 3 in 4 Canadians saying, I have at least a somewhat high level of trust in these organizations. And I'm able to separate a government agency from maybe my political views, which I think is important given the context for when this survey was done and how Canadians feel right now about their political federal government, not so much maybe the senior bureaucrats that run it. Academic research advisors, hospital administrators, patient-led organizations, all of those find at least 2 in 3 Canadians saying they have high levels of trust. But when we get to other types of leaders, journalists, just under half now have trust. It's up slightly from last year. Good news is, some of these are up, by the way, which counters the trend that as more people seem to believe they're exposed to bad stuff, maybe trust is going to come back. And that's my hope. And that's my optimism kind of breaking through. Look at the gap between how Canadians feel about Canadian news organizations and American ones, right? That's a significant gap in that sense. And that goes to my point earlier about where we're getting our information and the importance of having an active, strong domestic ecosystem of Canadian information. And look who's at the bottom. Can almost replace that slide with that picture at Trump's inauguration of all the founders of some of these organizations standing there with them. But Facebook, Reddit, Instagram, X at the bottom, only about 1 in 4 Canadians say they trust those platforms as sources of information. Now, the problem with a platform, not only are they in it for the money and they're in it to drive engagement, but they're just simply the vessel, they'll argue, for the people who share it. And so the trust isn't there, yet we know more and more people every single day are going onto those platforms. So a low level of trust doesn't mean people aren't accessing it. So just to wrap up shortly, when we ask people, who do you think is responsible or best positioned to provide protection from misinformation? And here I think is one in which Canadians actually reflect on this and say, well, it's not going to be the platform or channel owners. They're at the bottom of the list. Only 15% of Canadians put them, and you could rank 3. You could pick 3 of these that you think are most responsible. At the top of the list is Health Canada, right? Is our federal government. They are the protectors of regulation. Provincial ministries of health, associations and groups representing health professionals up 3 from last year. Professional bodies and colleges round out sort of that point in which about 4 in 10 think they have a responsibility. But if you look at what's second last, only 1 in 4 Canadians think they have most of the responsibility to protect this information. That's an honest assessment if you ask yourselves, right? It's like, I know I'm not very good at this. I know we can't trust ourselves, and so we need others to help do that. And I think that message comes pretty clear from this. Despite increase in misinformation, the majority of Canadians, though, feel they can find information that is accurate, unbiased, and helpful. But that's just the slight majority. Think of the other side of that. 4 in 10 Canadians say, I'm not confident that if I needed to find out what I need, what I have, what I'm feeling, why I'm feeling it, that I couldn't get that information accurately. That is, I think, if anything, one of the biggest takeaways of the survey. But the good news is that seeing health coverage, those who are exposed to more health coverage, they see it in the news, they see it in those trusted sources, actually are more inclined to feel informed and are more inclined to believe they've learned something new, which shows us there's a direct relationship between that health of that ecosystem and everything else. Finally, we've seen a 9-point increase. That's big in a year-over-year study, who feel that better access to health information will help counter the rise of misinformation. So if anything, that's a signal to us that Canadians want a better system. We know they're not willing really to pay for it. There's more to come on that. We got to maybe get them there. But they at least recognize the problem and how they're going to get there. So I end with this idea, right? If we can't agree on the facts, we can't agree on the solutions. It's as simple as that, right? And so I think that this data demonstrates just how important a robust, trustworthy news and information ecosystem is, because it's the connective tissue. It's the foundation by which everything else is built. Right? I spend my life, I'm obsessed with public opinion. I'm fascinated by why people think what they do. And sometimes you're shocked at what people think. But if we don't ask ourselves, how did they get there? And how do we get them back? We can't then say, well, that's just how it's going to be. We can't accept it. And so I'm really excited that this work is going to continue. And I'm thrilled to welcome the panel up to dig deeper into all of this. So thanks so much for your time, and have a great day.
Hello, everybody. That was grim. Thank you. Just to acknowledge the mood in the room for a moment. Listen, I'm excited to be talking about this with all of you. I think maybe the idea of susceptibility is a useful frame for this entire conversation, because that is what we're working with. We're working with sort of like a bit of the reality on the ground in terms of how we think about misinformation. And I say this as someone whose relationship to misinformation changed, I think, over the years. I used to be someone who sort of treated it as like a joke, I think. And I'm not sure that I'm the only one. I think there's a lot of people who thought, oh gosh, some people don't exist in a particularly high information ecosystem. That's silly. There's a lot of good information available all the time. How could they possibly not access that? And then gradually, the seriousness of that set in, and then you get that. And so maybe the place to start is just with the reactions to the survey. Dr. Reimer, maybe I'll start with you.
Sure. I mean, I think the survey is really sobering, because it shows us something that I think anyone who works in healthcare has been feeling, but put it into numbers. And it's really helpful to see the tracking, because what we saw there is the same thing that we're hearing when we talk to health professionals. And that's that we have this dual issue going on where people both are being bombarded with misinformation while at the same time not able to access healthcare. And when you have both of those happening at the same time, that puts people in an extra vulnerable spot. They don't have that relationship with a trusted health professional to give them the information they need. So 37% of people who answered that survey told us because they don't have that access, they're going online. And that leads to a huge problem, because they have health questions. They can't get them answered in a reliable way, and they're seeking it out wherever they can get it, which we know can fill them with misinformation, because we know that these algorithms are designed to push that information to them. So it's really quite sobering to see this double whammy happening at the same time, because I don't think any other generation has ever had both of these two issues combining in such a way. And that's something that's really concerning to physicians, to other health professionals, and I think probably to everyone who's in this room.
I want to come back to that idea, the idea of how this changes the work for physicians and for professionals in this field. But Dr. Tan, maybe we'll go to you with the public health implications of the research that we just saw. What are you thinking about?
Well, a lot of thoughts were going through my head, but thank you for the actual data, because I think that helps us right-size the problem, not exaggerate it, not contract it, but also helps us focus maybe on some areas where we can work on. And I think, and some of the trends I think are similar to some of the surveys that we've been tracking along at the same time, so that's very helpful. I think it is very concerning from a public health perspective on the one hand, because public health, I always say, works as the speed of trust. If we did not have the trust that the public have on us, our messages, our recommendation and advice will not resonate, and people won't follow that advice. So it is extremely important. I always say it's as important as having a vaccine. And if people lose trust, it's like losing vaccine effectiveness. And both are going to have a significant impact on the health of the population. I think the survey also showed us that some of the determinants of health, I am kind of thinking about that in that space, in that where you exist and live in the information space or ecosystem is as important as where you physically live and work and play. And so that's something for us to think about. On the other side, I'm somewhat hopeful because not, a majority of people surveyed still trust physicians, doctors, nurses, pharmacists, and in fact, in Health Canada and the Public Health Agency. That gives me hope that there's something that we can collectively do together at the same time as there's a sense of responsibility of how can we do better in getting that trust, maintaining it, as well as giving the information that people want to access to get better informed.
What I like about that is the difference between you and me. You're like, I'm actually kind of hopeful. And to me, that's a reflection of like my general naivete about this, which is to say, I thought we were better. And then I was like, oh, that's worse than I thought. And you're like, actually, this is a better picture than I thought it was going to be. And so that speaks to our disposition, I think,
Possibly, but I think hope leads to action. So you can't just be optimistic and it's going to work out. That's not the point.
Yeah.
I think hope essentially behooves us to take action.
Craig, you've spent a lot of time on misinformation. You've been doing it for more than a decade in terms of like covering the area.
Not producing it.
Not
right?
producing.
Yes.
Not one of the primary producers of misinformation. But like, I mean, listen, I think of you as like a Richard Attenborough, of misinformation. You're like, this is how it functions. This is how it spreads. Like, because you've been there since the very beginning. So like, when you look at this survey, what's your reaction? What are you thinking about in terms of like the place that we've gotten to?
Yeah, I mean, there was a bunch of things. I sort of looked at it a little bit ahead of time, but seeing it presented, I really agree with the point about you have to connect it to access to the health system and services. I think because, and this is where I think of it in the journalistic context, when we've been losing local journalists across the country because the business model doesn't work, the average Canadian interacting with a journalist, like 15 years ago, maybe they were in their community, you had kids in the same club or what have you. So a journalist was human. It wasn't the faceless institution. And similarly with medical professionals, if you have a doctor and you can have regular interactions, that relationship is a huge, huge value, and that can build the trust right there. But even if you have a doctor and that doctor can only give you 15 minutes at a time now, that can also be kind of to a detriment. And so I think the access and the services and the connection to that is really important, because then if you think people don't have that, where do they go? Well, if my doctor can only give me 15 minutes at a time, I can go to YouTube and I can find somebody who will spend hours with me across many, many videos talking about something, walking me through it, making me feel like they're treating me in a respectful way. And so, where do people go? So that, I think that connection is really important. And we struggle with it in journalism because there's just not as many journalists in communities. People don't see and experience the value. And if I were to pick a hopeful note, and it was framed, I think, in somewhat, negative or concerning terms. Like you had a lot of people answering questions about, is this true or is this false? Or, do you believe it? And a bunch of people answered not sure. And you could look at that and say like, well, this is clearly true. Why are they not sure? But you can also look at it and say like, these people are up for grabs. And I'll tell you that like, the dedicated anti-vaccine community and other people who are very much activists in sort of misinformation-oriented communities, that's how they view it. And they are recruiting. And they are trying to convince people. And so if we sort of, shake our head and say, oh, why aren't they sure? Well, if they aren't sure, then it's the job and the opportunity to go out there and help them and provide information to them. And that goes to sort of the last piece, which is there was a data point about younger generations, sort of like the amount of information they see on something, there might be a connection between that and whether they trust it and believe it. That piece of saturation is really important because if you are consuming in a feed, in an algorithmically sorted feed, and all of a sudden it's like, yeah, there's just a lot of people saying this, that can sort of stick with you. And the argument itself sort of dissipates when you start to feel you've been saturated by it, and it might become part of your view. And so it's not like you not only just being present there and having trusted professionals there, but you also have to figure out an abundance strategy because you need to saturate people. And like there's an opportunity to reach people, but those are some of the challenges that a lot of the bad actors are frankly better at than a lot of us are.
So it's not enough to actually, if I can take your hopeful point and make it not hopeful.
Yeah.
It's not enough to counter the information. You have to also say, you have to get basically enough.
Critical mass. Yeah. Like there was a study done, I think it was published in Nature a few years ago, where they actually modeled the behavior of anti-vaccine and sort of pro or neutral vaccine communities on Facebook through groups. And you could see the anti-vaccine groups going out and recruiting and trying to pull people from neutral and from in the middle. And so for them, they have a cause. And so if you aren't motivated like that, you are not going to convince people as well as they do.
For those keeping count, it's 2 for hope, 1 against. So that's not bad, actually. That's way better than I thought we were going to do. Angela, I was sitting next to Angela as David was going through their presentation, and then we got to that slide about the idea of more and more Canadians avoiding the news because it's causing overwhelm. Then Angela leaned over and she was like, I have an answer for that. And maybe this is your opportunity to give that answer. And I say this because, you know, they used to say that you're the answer. They used to say an institution like the Globe and Mail is the answer. They still say that. I'm not sure that's true. Do you think it's true?
It is definitely getting, I mean, it has been very, very difficult for the last number of years. You know, to pick up on something Craig said, like the platforms and the algorithms, there are people who are tweaking those algorithms every single day. And there are people behind that who decide what we think is true and not true. And that is like an extremely dangerous place to be. And I'm sure we're going to get into the Online News Act and Facebook blocking because I have lots to say about that. But I do think there are some challenges there. Where I'm hopeful, going to get you back on tie, we're going to tie, is I think, you know, we have been studying this problem for a long time. And there's 2 other terms I add to misinformation and disinformation, which is dishonesty and misdirection. And those 2 are also, I think we're going to see a ton of that in 2025 and beyond. So we might be having a panel on that topic in the future. You know, at the Globe, we have seen this and we're very concerned about news avoidance. And so we have done a number of things. Last year, we started creating some new beats and some new we just put people in some different roles. So for example, Erin Anderson, who used to cover mental health for us, is now covering happiness. Her job title is happiness reporter, which I love because it's still mental health, but we're coming at it from a more positive viewpoint. And the response to the stories that she has written is phenomenal. And a lot of the commenters, and you can go see them yourselves, basically say, I was avoiding the news, but I will read things like this. So that's great. Good for us. And, you know, we've added like food culture and online culture and some other things. We've also really beefed up our health reporting team. So, you know, post-pandemic, it dwindled a bit, I will admit. And now we're about a team of 10. We've got 5 reporters on it. We've got a few more starting in a couple of weeks. And what we're hoping will happen is as people can see more and more headlines, they have an option for a trusted news source. There is still a massive discoverability problem though. And I think that is something, well, okay, I'll get to Facebook now. One of the challenges, I can't help it, I'm sorry. You know, one of the challenges is, okay, so I'll tell you a short little story. So 2 years ago, I was diagnosed with breast cancer. I'm okay now, but I went through the whole gamut of care. And, you know, I belong to a lot of breast cancer groups now, and tamoxifen groups, just, you know, in my post world. They can't post proper scientific studies on those channels and on those groups because Facebook won't show a link. If anything has theglobeandmail.com, it is blocked. It is not shown. And I think what's happening is where people used to share good quality information, now all they can share is crap. And I'm sorry, yes, I'm going to use that word. They have no choice but to share bad information or someone who's paraphrasing it that isn't trained to paraphrase medical and health information and scientific data. And like, we should all be really worried about that.
I thought you were going to make a point for hope.
The hope is that we are adding to the solution.
Okay. I do want to come back to that because I think like it's not, we are talking about institutions that are not shying away from this problem. That is why we're having this conversation. But maybe it'd be useful to sort of like to get a little bit more context just in terms of the way that misinformation shows up in your work. And again, Dr. Ryan, I'll start with you on this. How has misinformation sort of changed how you approach the work that you do?
Yeah, it sounds sometimes like we're maybe exaggerating when we talk about how misinformation can be a life and death situation. And I know there's several physicians in the room, and I suspect you have similar stories, but I'm going to share a story from one of my recent hospital shifts where I work at a women's hospital, and we had somebody who had a postpartum hemorrhage after delivering a baby. So that's when you have a lot of bleeding after having a baby. It's actually the #1 cause of maternal death globally. And this person needed a transfusion to replace the blood she lost. And she refused that transfusion because she didn't want vaccinated blood. And that is heartbreaking because this was someone who is trying to make the best decisions for herself, for her family, for her new baby. She obviously wants what's best for this new child she just had. And she was making a decision based on bad information that became a life or death situation. These are human problems. We see the numbers, and those are really important to track. But on a day-to-day basis, everybody in this room has had an issue with access to care, or you have a loved one who has had an issue with access to care. All of you can name somebody who couldn't get care when they needed it. And that is when people are turning to these sources. And when their Facebook group that used to share good information about breast cancer no longer does that, this is where people come in and are saying they're refusing the chemo. They're refusing to take their tamoxifen or other medications because they saw something about how it causes other cancers. And this is where we see these heartbreaking stories that are very real. And like I said, I know the doctors in the room could tell similar stories. They've had this happen. And what we really want to see is the social media organizations taking accountability for this, because they are pushing this misinformation at people. The algorithms make money for these organizations based on the clicks they get on this misinformation. And if they wanted to change their algorithm to push accurate information, they could do that today. And they can make a difference for Canadians, for Americans, for everybody who is consuming this information, whether they want to consume it or not. And that's where we need to keep this focused, is on the human outcome, because that is what we're seeing in the healthcare system. And at the same time, we need to be fixing the issues in the healthcare system, because that access is what's leading people to more misinformation. And so we have dual fights that we need to be fighting right now.
Can I ask you a follow-up that was one of the questions that came in from the room, but I think is actually is a sensitive question and maybe a difficult one. But and the question is, many provincial health organizations representing specific professions like doctors have these ongoing campaigns in the public domain where they talk about some of the difficult things that are happening in the healthcare system. They're often critical of some of those problems in the healthcare system. And this question is asking, and I think it's a good one, is these messages are often accurate, but can you speak to how those advocacy efforts can sometimes contribute to people's perception of the erosion of the quality of the healthcare system? Because I don't know if those two things can in fact be disentangled. How do you balance saying there are problems, but also please go to your doctor?
Well, and I find that question really hard, because I get asked by journalists frequently, well, what would you say to Canadians who can't access a family doctor? And it's hard because I don't always have a great answer, because if you can't access reliable, trusted relationships with health experts, that is a really tough spot to be in. So we give them advice about, you should go to Health Canada's website, the Public Health Agency of Canada. If you have diabetes, go to the Canadian Diabetes Association. If you're pregnant, go to pregnancyandYou.com. There are resources, but it's still a problem. And when we talk about it, we know we're advocating because we're trying to push politicians and decision makers to make the right decisions to make the health system better. But Canadians are hearing it too, and they're experiencing it. And so we're trying to say, yes, please do talk to your doctor. But the reality is a lot of them don't have a doctor to talk to.
I'm losing count in terms of what the score is. Going to come back to that in just a moment. Dr. Tam, how does misinformation show up in your work? So when you as you sort of go about your work, how has it changed your approach to your job?
Well, I think as the survey also shows, that misinformation can have very real impacts, not only for an individual, but for populations. So that's where I work. So I'll speak a couple of things. One is impact on vaccination, of course, vaccination uptake, and any future pandemic response. If you sort of top of mind, kind of just key examples. So I think, so the Public Health Agency and Health Canada commissioned the Council of Canadian Academies to do a report called Fault Lines, which very clearly sort of show, this is an independent sort of research showing that when the COVID vaccine became available between March and November of 2021, the lack of vaccine confidence, which is linked to misinformation, but also other factors like access and can really impact your health, because they calculated that like 2,800 avoidable deaths are related to people's distrust, I think, of vaccines, and hundreds of millions of dollars of hospitalization costs. So that's just an example that was done in one point in time. And I think the youth, the data showing that youth have more distrust and getting the information in the social media space is something that is, I think, a priority focus. Because they're the parents of tomorrow and they decide whether their children get vaccinated. So again, when we looked at the provincial vaccine coverage from before the pandemic to now, last year, there is a drop in vaccine coverage. For 2-year-olds like measles, MMR, there's a drop of about, I think, 7 percentage points, which is massive. If you're thinking about measles outbreaks, massive, you need really high coverage. So that's really concerning. And anything that we can do to ensure younger adults have access to the information they need to protect themselves and their future children is of paramount importance. And then we come to the fact that a pandemic, another one, will occur. We just don't know when. We're watching a whole bunch of viruses, H5N1 being top of mind at the moment. We don't know what's going to happen next. We're tracking it, etc. I'm concerned that it will be more difficult now than it was at the beginning of 2020 to get the public on board, because of the diminishing trust in certain institutions, hopefully not as much for the Public Health Agency, but there is that loss of trust. And and that's a very key predictor of whether someone take up protective measures. Two, of course, is new technologies, people's trust in new technologies. The mRNA vaccine, which is an absolute miracle to the public health system and the healthcare system, is being viewed with distrust. And we need to do better in explaining new technologies to people and how science works, how trials are done, how things are discovered in understandable terms, so that we can bridge that gap and sort of get that thermometer further up on the trust thermometer. The Edelman and others are tracking all these trusts. I read all their barometers all the time just to see how we can adapt our response. But that's just a couple of examples. We never got into, healthy eating or, physical activity, all of those domains, men's health. There's so many areas of health prevention, health promotion, and then these response to crises where we have to collaboratively find collective action.
I want to hold on something really important that you said there, which is the idea that if we don't know when another pandemic will happen, and if another one should occur, you feel like we are maybe in a worse trust environment than we were in 2020 in terms of our ability to respond to another one. That's a really big thing. That's not a small thing at all. So I just wanted to sort of pull out that detail from the thing that you just said, and maybe put it to Craig like this. I think like when I made the Richard Attenborough joke earlier, what I was really trying to say—
that was a joke?
That was
wow.
Okay. What I was trying to say is you've sort of followed the evolution of this from individual sort of plugging leaks problem to a systems-wide problem. I remember sitting next to you as you reported on like Norwegian teenagers who have created like a fake website, who they were Macedonian teenagers, my apologies, who created like a fake website, and they were tricking a lot of people into believing, incorrect things about Canadian news. And you were pointing and saying like, look, this is a problem. We get to a place where the platforms, Facebook specifically, but all the major social media platforms say, this is a problem and we want to do something about this. I'm not supposed to ask a leading question. So here's my question to you. Do you believe them?
Well, if you look where we are today, they've actually, in a lot of cases, especially with Meta, they've gone back on that now. So like we had a time between about 2010 and the end of 2016 where they didn't consider themselves to have a responsibility around like the quality of the information. It was systems driven to feed people what made them spend more time on it and engage with it.
Yeah.
And so during that period, the early stuff that we were seeing were, hoaxes of celebrity deaths and like crazy made up stories about, somebody dying in a weird circumstance or something like that. And that stuff was like gangbusters on Facebook. And then you get to the end of 2016, and because of elections in the Philippines, because of Brexit, because of Trump being elected the first time, suddenly the platforms, and particularly Facebook, say, yeah, we didn't take our responsibility seriously enough. We're going to really work to help elevate quality information, to get rid of hoaxes, to work to sort of do something in a different way. And that period probably started ending about 2 to 3 years ago. And I'd say very much with, yesterday's inauguration, we're very much out of that. And so whether it goes back to the period of where it was before, or whether it's actually what they're saying is sort of, we're going to be more hands off, we're not going to censor, where they actually let the guardrails off even more than was pre-2016. I mean, it's hard to know, but I do think at this point, this for Facebook, if we're talking specifically about that platform, this is where they started. They're going back to it. And with Twitter, they didn't take the same sort of post-2016 approach that Facebook did. They didn't work with fact checkers. They did things like they would, curate quality information. Those teams were fired when Musk took over. And so now we have a lot of people moving more to the Twitter/X model. And so I think if you look at it, you would say overall, these platforms have never really fully committed to it because we've gone through phases where they're trying to read the political moment, they're trying to read the public sense of it. But Mark Zuckerberg, when he said that the fact checkers were too politically biased and we were censoring too much, I mean, he could have made these changes without having to go that far. And so I wonder if he's able to walk that back. At that point, no one, I think, would believe him if he suddenly said, oh, we didn't take our responsibility seriously enough again, and now we're going to change back. And so for me, it's like this is a return to what a lot of these platforms were kind of like, with the exception of Twitter, where I think the thumb is on the scale towards things that Musk agrees with and likes.
Thank you.
That would go in the depressing.
I know.
Yeah.
I don't think anyone was confused as to which aisle that one was going to go in. Angela, not to make it worse, but I do think it's actually important to contextualize how the environment is different in Canada, which is to say, at least in the US on Facebook, you can post a New York Times link, right? Like even with everything that Craig just said, some people have the ability to post reputable newspaper sources, reputable news sources that people can engage with. That right now, as it exists in this country, is not an option for you. You can't post a Globe and Mail link. You can't post a CBC link. That is not
can't post a New York Times link.
Cannot post a New York Times link. How do you operate in this environment? And where should people be directing pressure or attention as we start to think about how big of a problem that is right now?
Yeah. It is a massive problem. We saw it with the BC fires a couple of years ago. We've got an election coming up now, and imagine you cannot post a news story from a reputable Canadian source. No CBC, no Globe and Mail, no Toronto Star, no anything. I wonder what the election is going to look like. What we've done at the Globe and Mail is we've really doubled down on owned and operated, and really said, whether it's the newspaper, our mobile site, alerts, newsletters, whatever it is, we've just really doubled down and said, these are the things we can control. We're going to make sure that anything we write, we put out is evidence-based, is researched, follows all of the Globe and Mail guidelines. We've hired 29 new reporters. And, I don't know if anyone has noticed, but in the last few months, there's been a lot of different kind of content coming out. And that is sort of our way to combat some of what's going on.
Yeah.
Is at the end of the day, when the pandemic first happened, people were coming to us in droves. Whenever a big major news event comes up, people come to the Globe and Mail, and I'm sure they go to their other favorite sources as well of reliable information. And that tells me when people are scared, when something's on the line, their house might burn down, they come to a reputable source. They know that Facebook isn't there. So at the end of the day, I have to hope that at the back of people's minds, they do know the difference. I'm also a believer that, if we put out really good content, and we work on the discoverability problem, we are going to get Canadians back. You know, in some ways, AI and the chaos that it is creating, and you know, I actually find a lot of our readers say that the internet is even less trustworthy now, and so they want to go to a site like the Globe and Mail where we don't have anything, you know, like the AI bots that you're seeing on Google and Facebook and everywhere else. And so, you know, it could be a great thing that happens for us, that people that come back to it. But yeah, I think in terms of what people can do in this room and everywhere else, like the Canadian Journalism Foundation has a great campaign, a media literacy campaign about trusting wisely. And I say that all the time, like trust wisely. And I think if we can get Canadians to think about that, and so maybe, you know, some of the money that go to attack ads and whatnot, maybe institutions can work together, because I think the number one crisis to our democracy in this country is going to be not having access to information.
It is like the fourth quarter. Hope is down 20 points at this point. But also, let's score some points for Hope if we can. And by that, I mean, I want to focus not on a utopia, not in a perfect world, but on the next right thing, right? Like sort of like where from your standpoint, the next problem to solve, what feels like the most accessible place to go to next. And maybe, Dr. Ryan, we'll start with you in terms of saying, where do you turn to next to say, that's where we should go?
I mean, really listening to this panel, seeing recent news, seeing, you know, the US leave the WHO and the Paris Accords, I feel more concerned now than I've ever felt about the misinformation environment. But I want that to be a driver for change. I want that to be something that people take, and rather than just feeling that this is hopeless, that people feel like we need to be part of a solution, we need to move forward. And so I'll share a little bit. The Canadian Medical Association values a healthy news ecosystem and sees that as critical to the health of Canadians. And so we've invested in health journalism. We're supporting multiple health journalists in Canada. We also have our Healthcare for Real channels, which is our social media channels that try to demystify the healthcare system and provide it in a way that's easy to understand, despite how complex our health systems are. We also have a social media network of support for physicians who are active online, to try to give them a place where they can get support, where they can get access to information, where they can get advice on how to do this in a way that can reach Canadians. And we're tracking it, like in the survey. So there's many things that we see as critical roles. Physicians, thankfully, remain the most trusted healthcare professionals, but that means that we have a duty to care. That means that we have the duty for the patient right in front of us, but for all Canadians. And we take that really seriously, and we will continue to invest in making sure that we're part of the solution, that we're part of moving forward on having these trusted sources of information in traditional media, but also on social media. And we also want to see, appropriate budgets for things like the Public Health Agency of Canada or Health Canada's communication budgets, because they still are trusted sources and need to be able to share information in an accurate way that Canadians can go to. So these are some of the solutions that we're working on now. At the same time as we're advocating for changes to the health system to address the access thing. But I think that's a discussion for a different day, because I could talk for a very long time about access to care. These are all really important, and things that I hope everybody in this room, everybody online takes to heart and joins this battle against misinformation, because when we have shared context, when we have shared information, we truly can fight back and produce an ecosystem that is supportive for Canadians and gives them a better chance at health.
I'm heartened to hear that, I think, because there's so much of this conversation has been about the worries that we have about social media, but the answer isn't to cede the space, right? The answer isn't to sort of like completely abandon the space and say, no, we're going to completely withdraw from existing in the space, because you also have to have good information available there. And maybe you won't have immediately the critical mass that Craig was talking about, but it takes time, and you can't build that if you don't actually start, by doing that. Craig, when you sort of think about what Dr. Reimer just said, this idea of like existing in these spaces, what is the next right thing? Like, how do you sort of like, what is the next step that you take?
I mean, I think the big thing is everyone understanding that you actually have some power and some role in it. Whatever you do for a living, it doesn't matter. The reality is that you making choices about what you're consuming and also what you are amplifying, not even just what you share, but also when you look at something, when you stop scrolling on a platform like TikTok or Facebook, that is something, a signal that they take. And the longer you stay watching at that, they say, oh, this was interesting to this type of person. Maybe this other type of person would also like that content. And so to be aware that as you are consuming and as you are interacting, you are sending signals out there to these systems. And so if you choose to engage with stuff that is quality, that does have, rooted in some professional expertise or, quality information, you can send those signals out. And so it's true, like to get to the critical mass, it takes a lot of work at a lot of different levels. But if you have CMA and you have other organizations who are trying to do that, you individually can also play a part in it. And so like for me, that's always the helpful thing to remember is that the systems can sort of show things to you and influence you, but also you can send signals back and you can sort of share and engage with things that you think are worthy, and that can have an effect. Obviously, it'd be nice if news articles could do that on Facebook.
Yeah.
But in terms of the things that are available now, take that as you do have a role. You shouldn't feel powerless. There is something you can do on that level, and also how you engage with people in your life.
Yeah, you're not a neutral consumer of the information. The signals that you participate in do inform what else gets to other people.
Yeah.
What I heard is that everyone should follow Healthcare for Real.
That is also what I heard. Wow, I thought we all heard that. I think I take that point seriously, the idea that your attention is a resource that you should not be just handing out for no reason.
Mm-hmm.
Same as your trust being a resource that you should not be handing out for any reason. You should be sort of considered about where and how you end up spending that resource. Angela, when you think about the next right thing, the sort of like next step to take, is it for people to call the representatives and go like, I get why you were doing the Online News Act, but gosh, it's sure not helping. Like, is that the step? Like, where do you see the next movement for people?
I mean, I think that is a definite step. If people want to see quality news on Instagram and Facebook, that is where you would start for sure. The obvious thing is buy a subscription to the Globe and Mail or any other newspaper or media outlet. Consume the things that, to Craig's point, you believe in. I think as a society, with the federal election that is likely very, very soon, we have to bring these topics out to the forefront. Economics are probably going to be a big part of the election for sure, but I think healthcare and health information should be also, and how we put that on the agenda and make it part of the conversation is up to us. It's up to every individual. The Globe will be doing its part as well, but I think that is where people can be mobilized as well.
Dr. Tam, listen, you're the quarterback here, man. This hope is relying on you, but also
Thank you.
I sort of like left you in this position specifically because I think like we are all familiar with your face as sort of a calming presence in the middle of a lot of misinformation, but also just like an information vacuum. And we got used to hearing you speak from that position and be like, here's what we do know, here's what we don't know. As you think about this particular storm, what is the next right thing?
Well, I think my hope lies in the fact that there's actually an increasing number of people working in this space, people who are passionate about getting credible information to the general public. So I think that's really important. But it's just like the information ecosystem, we're all a bit fragmented. So I think this panel, just by joining up with some of the people on this panel, I just know that there's more we can do to join ourselves up, amplify each other's work a bit more. But I'll talk about this, what we should really be focusing on in the way that I think about public health in general. And there is no one singular solution. It's going to be multiple layers of protection. And it's a bit like what I said during the pandemic, is that one layer is not going to be perfect. So you need multiple layers. The other concept is that we think about up and downstream actions. So downstream is when something's just occurred, you have to do something about it, fact check the thing and for people to debunk. Well, I'm very much interested in prevention and more pre-bunking. This is a term now that we're getting more used to, and there's some very key actors in this space including entities like Science Up First, which is supported by a network of science centers, and of course, Tim Caulfield in his own way, and the University of Alberta. These networks exist, and they're there to not just address the piece of disinformation. They are trying to tell the public, these are the tactics that you should be aware of that's going to come at you before even the piece of misinformation occurs. This is how social media works. This is how they're rewarding the dissemination of misinformation so that individuals feel empowered. But you go further upstream, is about literacy, strengthening, reducing susceptibility and strengthening resilience of individuals, of students, on media, science, and all types of literacy. But if you go even further upstream, there are systemic things that we need to do. I think from the public health community, filling the information void is one thing, but setting up the necessary governance and the best practices in public engagement is really important. Communities want to engage. So what they're telling us is they want transparency, operational transparency. How did you get to that conclusion? Why did you make that recommendation? And try and explain, so how do vaccines sort of approvals work, all that sort of stuff, operational transparency. Secondly, is they want to be part of the decision-making process. So how do we get our governance and the way that we construct our recommendations policy so that there is a component of true, meaningful engagement of the communities? So we do support a number of activities on that front. One is actually on more a sort of academic research space, setting up toolkits. SFU, Simon Fraser University, is helping us set up toolkits for how do you engage the public, for example, on digital health and health data. How is it collected and analyzed, disseminated? That's something that people have some trust issues about too. So that kind of thing. But two is we actually fund community leaders who have the trust of the communities. Communities where for all the very reasonable, valid reason they distrust the system, there will always that be, and it's valid because they've been discriminated against, for example. And they have community leaders. We need to give them the information, just like we give health professionals the necessary information so that they communicate with their patients. Community organizations and leaders, faith leaders, indigenous leaders, needs to have that information so they can get their communities on board. Because I am very realistic, knowing that people are not all going to listen to the Public Health Agency or myself. So getting a whole troop of people together, giving them what they need for them who already have the trusted relationship to get the message out there, I think is really key, including youth.
That was a really beautiful answer. And also, like, can I just say, Colleen definitely gave me the 5-minute warning like 15 minutes ago. But can I just ask a follow-up question to that real quick? Because we have to go in a minute. But my follow-up is, do you not hear that the idea that that some people want more operational transparency in terms of how some certain decisions were arrived at? Does any part of you chafe against that and go like, well, we arrived at it because we know what we're doing? You know, like, why should we sort of have to answer to you? Or do you just sort of see it as like some kind of like a realistic, you know, challenge of the moment, being like, we have to open up that process and let more people in to have opinions about how we arrived at certain conclusions, because like that is the media, that is the sort of environment we're operating in. Does any part of you, you know, chafe against that?
Well, I think it's actually a necessary thing to do because we've heard that's what people want. But it's a bit like explaining the scientific process. People need to understand how that works and how there is tension, and people debate things all the time, not because, you know, they should trust that the scientific process is about debate and about uncertainty. So I think being able to let people in, or have journalists actually help us explain. That's what I think. There's great journalists.
Give us the access.
You know, they explain things better than I do. Yeah. And by the way, the David Attenborough sort of comment is observing animal behavior. Humans are a type of animals. Yeah. And so behavioral science and actually truly understanding what drives people to behave so is extremely important, and we've tried to incorporate that into public health. But it is what the social media platforms are very good at doing. They know exactly how to get people essentially link into the platform incessantly because they know how to work those brain circuits and rewire them, basically. So just like the observation of animal behavior, this branch of science, if you like, is going to help us, I think, as well.
See, there's a reason I chose you as a quarterback. So we did it, I think. I think hope wins that round. But also, I just want to say thank you to our wonderful panelists. Thank you so much, you guys. Really appreciate it. Oh, of course.
Thank you, Elaine. Our mission, as you can see there on our sign, is to engage Canadians on the issues that matter most. And I think today is an excellent example of this because it has implications across healthcare, but across so many parts of our lives. So on behalf of Canadian Club Toronto, I would like to thank all of you very much. Your expertise, how you brought this to life for us is incredibly important. So thank you to you, to the CMA. We appreciate you choosing our podium to release this information today. David, thank you for taking us through the data so ably. Doctors Reimer and Tam, Craig and Angela, I just want to thank you for bringing a really sort of caring, human-centered perspective to this. Your insights, your commitment is obviously very clear. You also injected both hope and action into this conversation, so I really appreciate that. Elamine, we would love to have you back. Your energy around this and just how to make this accessible and for all of us, I think was fantastic. So thank you to you. I want everyone to know that we will be sending out the slides that David shared earlier on TikTok. Kidding, you're not going to get it on TikTok. You are going to get it through email. Colleen is having a heart attack as we speak. Before we close, let me share a couple of upcoming events with you, and then I know you've all got to get going. Wednesday, February 5th, we have the former Bank of Canada Governor Stephen Poloz, who's going to join us to talk about what we might expect for our economic future. February 11th, join us for breakfast as we open the Globe Exchange conference with Jay Bashir, Global Head of Sustainability for BNP Paribas Asset Management. Please visit our website at canadianclub.org. You'll get all the details there. I'd like to do one more round of thanks to MD Financial Management and Scotiabank for sponsoring today's event. And lastly, and always, I would like to thank our AV supporter, BBC Live, for facilitating today's event for all of those online. Thank you all for being here. We hope to see you again soon.